When you have this major depressive presentation mixed in with cyclicity and mixed features, if you will, then how does that change your evaluation? Your evaluation of not just unipolar depression, because you could have mixed features with unipolar depression, versus a bipolar 2.
This is critical. So when a patient is presenting with a depressive episode, at that time, we don't know if that's best explained by MDD or bipolar 1 or bipolar 2. So what we do is we need to step back and we need to, in fact, first of all, contemplate the possibility. And then what we need to think about are what's called the Robinson-Gouze validating factors. So what's the age at onset? It's the 75-25 rule, bipolar's earlier. How many episodes does the patient have? More common in bipolarity, hinting at cyclicity. What's the family history? Is it loaded for psychopathology? What are the patterns of comorbidity? Manpreet, how often do patients come and they say, I had ADHD when I was 7, I had anxiety when I was 12, I have then migraine headache, I have panic attacks at 18, depression. Is that comorbidity, or is that the same disorder just changing its face over time? So you're listening for this polymorbidity history. By the way, we call that heterotypic continuity across time. And what we're also paying close attention to is response to treatment. Patient comes to me and they say, I'm depressed, and I've been on Prozac, Zoloft, I've been on Lexapro, I've been on Effexor, I've been on, none of them work. Well, that could be the case. It could also be the case the diagnosis is not correct. We make so much about antidepressants causing people to become hypomanic or manic. That doesn't happen very often. What more often happens is they have what's called acid, not LSD. But what happens is they have antidepressant-induced chronic irritability and dysphoria. They get kind of irritable on them, and you're not sure what's the drug and what's the disease and so on and so on. But that's
what a great mnemonic. I love that one, and I'm going to use it. Just like I'm going to copiously use your 5 A's mnemonic here. Anxiety, agitation, anger, irritability, attentional disturbance, distractibility, and you recently added, Dr. McIntyre, anhedonia.